Hi, I'm Dr. Carol Barsky, Chief Quality and Value Officer at Dartmouth-Hitchcock Health. I joined the health system last spring to lead Dartmouth-Hitchcock Health's patient safety and quality programs, including our preparation and response to emerging infections and the pandemic. I'm impressed and moved by the steadfast dedication and expertise our healthcare teams have demonstrated and will continue to demonstrate. It's important that we continue to provide you with the most up-to-date, fact-based COVID-19 information. We began this week with 66 patients hospitalized with COVID. 22 people are being treated by our visiting nurse service at home. These are high numbers for the people of New Hampshire and Vermont. And importantly, due to the Omicron variant, total numbers of infections and hospitalizations have not yet started to decline. The vaccine continues to be your best defense against this virus. You may have heard from COVID-positive patients, your family, or friends who are vaccinated, that they're angry because they got the virus even though they complied with the vaccine mandate. They question the vaccine's effectiveness and why we continue to promote it. Please know, the vaccine reduces your symptoms, keeps you out of the hospital, and saves lives. It won't entirely prevent everyone from getting COVID. That's why we continue to need the full suite of measures to prevent the virus's spread. Wearing masks, keeping social distance, and frequent testing. We continue to see more Omicron cases in our area. And while in general, Omicron causes a less severe illness, it is very contagious, so more people get the infection, and some will be severely ill and die. Masks continue to be another effective tool to reduce the spread and exposure to COVID-19. And I know there's a little confusion out there about what type of mask you should wear. In our hospitals, due to the high level of community transmission that we're seeing and the record high numbers of people hospitalized with COVID-19, we recently changed to require a medical-grade mask of everyone who comes into our facilities. We distribute these at our entrances instead of cloth masks or other masks you may be using at home. Studies have shown that medical-grade masks are more effective at filtering out virus particles. You also probably hear a lot about N95 masks versus medical masks. Here's the bottom line. All masks help by filtering out viral particles in the air. Medical masks filter out more particles than cloth masks. N95s add additional filtering capability. In the hospital, we use N95s in special areas, such as the emergency department, where there are high numbers of ill patients, many of whom have COVID. Ultimately, if you have to gather indoors during the winter months, please wear a mask, not only protect yourself, but to protect others. If you've taken all the precautions and you still find yourself COVID-19 positive, isolate at home. As much as possible, avoid contact with members of your own household. Come to the emergency department when you're unable to manage the effects of the virus at home, if you're short of breath or can't keep down foods or liquids. There's no need to come to a medical facility just to confirm a positive test result. If you need access to a test, you can order it free at home, COVID-19 antigen tests delivered to your door while supplies last. You may also have been hearing about an investigational COVID-19 medicine, AstraZeneca's Evusheld, which has been given emergency use authorization by the FDA. It's important to know that this monoclonal antibody is not a substitute for getting vaccinated, nor can it be used to prevent infection after you've been exposed. The antibody is designed to provide additional immunity to people 12 years of age or older who are moderately to severely immunocompromised due to an underlying medical condition, or people who take an immunosuppressive medication. Those individuals may not be able to generate a strong enough immune response from the COVID-19 vaccine, making them vulnerable to severe illness. Please know there's an extremely limited supply of Evusheld, which prevents us from being able to offer this medication to everyone who might be eligible at this point. Evusheld will be offered to the most vulnerable patients first, and we will continue to provide it in the weeks and months ahead. Please do not use these new therapies you're hearing about in the news as a reason to skip vaccination or to skip getting a booster. If you can get vaccinated, do so. Please know, our staff and providers are here for you and will continue to be, 7 days a week, 24 hours a day. We will navigate and overcome this pandemic together. We owe it to ourselves, our loved ones, and our community to vaccinate, wear masks, keep social distance, and test often. The more of us who do so, the faster we will emerge together. Thank you.